Cannabis used to be completely legal. It was sold in pharmacies all over the country to alleviate numerous effects, such as easing cholera symptoms and helping with stomach pain and vomiting. Smoking it was unheard of, though. The typical use was an over-the-counter pill or tincture. It had a completely positive reputation until around 1920. Following the Mexican Revolution, America gained hundreds of thousands of immigrants from Mexico. Instead of greeting these newcomers with open arms and open hearts, Americans met them with pride and prejudice. This extended to their habits as well, which included smoking cannabis. To defame Mexican immigrants, Texas police made outrageous claims about this habit. They're quoted saying it incites a lust for blood and that it gives superhuman strength to its users. Mexican immigrants were also unfairly accused of distributing it to school children. The head of the FBN, which is essentially a predecessor to the DEA, is quoted saying things like, "Reefer makes darkies think they're as good as white men." The city of El Paso, Texas, banned marijuana completely. Other states as well were beginning to associate marijuana with inferior races, prostitutes, and musicians. This association is one that led to the ban of marijuana. It can be noticed that in medicines it was called cannabis, and nobody had a problem with it. But when it was banned, it was called marijuana, which happens to be the Mexican name for the plant. This pattern of discrimination continued. In 1971, Nixon declared the war on drugs. He gave much more power to drug control agencies, he established mandatory sentencing for drug convictions, and he put marijuana in Schedule 1, meaning it had no medicinal value and high potential for abuse. Interestingly, the National Institute of Drug Abuse, which is a government agency, has since admitted that marijuana does have a range of medicinal qualities, but the scheduling remains unchanged. Nixon's aide, John Ehrlichman, is quoted saying, "You want to know what this was really all about? The Nixon campaign in 1968 and the Nixon White House after that had two enemies, the anti-war left and black people. Do you understand what I'm saying? We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and blacks with heroin and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did." Marijuana being in Schedule 1 has a very detrimental impact on our knowledge of the drug. To study marijuana, a scientist must apply to get a sample from a government-grown plant, and they must be temporarily deputized by the federal government, since handling of a Schedule 1 substance by anyone except a federal agent is a felony. This is not an issue for studying meth or cocaine, for example, which are both Schedule 2 drugs. This brings the issue of bias. There's only one entity in the United States that is legally allowed to grow and distribute marijuana, the National Institute of Drug Abuse, and their primary goal is to establish potential abuse of the drug, the negative effects. Furthermore, the marijuana that they distribute is much different than what a marijuana user smokes. It consists of mostly stems and leaves, which are two parts typically discarded, and it isn't regulated for contaminants. According to the director of MAPS, the government weed contained tested levels of yeast and mold far above standards for some states. This means that research done on the effects won't necessarily be accurate for marijuana that people are actually consuming. Marijuana's illegalization had little to do with its dangers, but that doesn't mean that there aren't any. You should be wary if you have a history of heart disease, as marijuana speeds up your heart rate, leading to a 5 times greater risk of heart attack in the first hour after you smoke. Marijuana use also makes you twice as likely to get a specific form of testicular cancer, though the risk remains relatively insignificant. You won't get lung cancer from it, but no smoke is good for your lungs, and frequent and heavy use for years will lead to chronic bronchitis. However, this can be mostly mitigated by vaping marijuana instead of smoking it. One study demonstrated that there's a link between marijuana and IQ decline. This link was originally stated as a causal association, but other researchers pointed out that the study was compromised by multiple flaws, and that skewed the results. A different study conducted similar research, but instead they used twins, one that used cannabis and one that did not. After about 10 years of use, it was shown that though marijuana smokers did experience an IQ decline, so did their non-smoking twins. This means that instead of marijuana causing an IQ decline, genetic predisposition and socioeconomic standing can lead to IQ decline as well as marijuana use. It's a correlation. Another critique of marijuana is its gateway status. Some people think that marijuana use will lead to harder and more serious drug use. Similar to the last topic, this is just a correlation. People who are likely to use marijuana are also likely to try other drugs. It just so happens that marijuana is one of the easiest to find. If it weren't marijuana, it would be something else. Some studies that have concluded that marijuana can actually help people get off of more dangerous drugs, coined the anti-gateway effect. This concept is demonstrated in an observational study of marijuana laws. Once medical and recreational laws were put in place, states with these laws experienced about 25% less opioid overdose rates compared to before the laws, as well as other states. This relationship is strengthened over time, as the overdose deaths decrease year after year in the states that have more lenient marijuana laws. From a holistic perspective, legal marijuana would be a very good thing for America. Colorado has already gained over $500 million in taxes, more than half of which went to K-12 education. Washington made recreational cannabis legal in 2012, and violent crimes have steadily fallen since then, according to the FBI. Aside from health concerns, there are stereotypes that marijuana makes users lazy. On the contrary, a study of 1,000 participants in California revealed that 43% of cannabis users were active outdoors once or more a week, compared to 35% of people supporting legalization that didn't use cannabis, and 25% of people against cannabis entirely. The same study found that 53% of users worked full-time jobs, compared to 47% and 33% of the same respective categories. To put marijuana in perspective, let's compare it to other legal drugs. Alcohol is responsible for more than 88,000 deaths per year. 26,000 were from excessive drinking alone, and it has very little health benefits. Cigarette smoking is responsible for more than 480,000 deaths per year, and has absolutely zero health benefits. Marijuana, on the other hand, does not directly cause any deaths and has significant health benefits. It's impossible to overdose on it, and it's a life-saving medicine for some people. Alcohol and tobacco are legal because it's been decided that American adults should be allowed to choose to alter their consciousness if they so desire, taking a break from their everyday life. This would be more beneficial and less dangerous if they had a safer alternative to choose from, one that, despite having risks and side effects, also has medical benefits, and it won't kill you. To use marijuana should be a choice made by the person deciding whether or not it's right for them, and those that use it as medicine should not have to hide and live in fear of going to prison or being ostracized by their community just for using their medicine.